Peace be upon to Madam Diana. We are from Group 5, CDIM 261 for SD1. And for today, we're going to present about our assignment, which is writing an article journal in impact of information governance in healthcare system. We hope you will enjoy our presentation. Okay, let me introduce to our team members. Me, myself, is NURQURAISYAH, and then we have ATIQAH, HANIM, and Huud. So these are the part of our team to the one that who wrote article journal.
Let's begin with a basic understanding of information governance with its IG. Based on Study Smart 2025, IG is a framework of policy, procedure, and technologies for managing information across its life cycle. The main goal of IG is to ensure information is accurate, secure, and compliance with the regulations. It also helps to improve efficiency, reduce risk, and maintain stakeholder trust. According to Auto 2011, IG also improved involve clear rules for creating, using, storing, and controlling data. It encourages us to answer key questions like what information do we need, how do we use it, and who is responsible for it. Lastly, IG promote a culture that respect and protect information as a valuable asset in a digital age. Next is healthcare system. According to Rules 2019, a healthcare system is an organized network of people, institutions, and resources that work together to deliver health service and improve population health. For World Health Organization 2007, it include all organizer, people, and action whose primary intent is to promote, restore, or maintain health. It's important to remember that healthcare system go beyond just hospital and clinic. They also include public health program, financing strategies, policy, and even community-based initiative. These systems are also very complex and dynamic, involving many independent actors like patient, healthcare provider, and policymaker. Because of this complexity, improving healthcare delivery require a system thinking approach, meaning we have to look at how all parts work together, not just individually.
So now moving on for our research objective that we're using in our essay. So firstly is to examine the role of information governance in enhancing the quality, security, and accessibility of healthcare data, and then to analyze the impact of effective information governance on clinical decision making and patient outcomes, and lastly to evaluate how information governance framework influence operational efficiency within healthcare organization. Now we're moving on to research question, and these are the questions that we were using at the excuse me. These are the questions that we were used in our essay. So firstly is what is the role of information governance? It's ensuring data quality, security, and confidentiality in healthcare service. Secondly is how does effective information governance influence clinical decision making and patient care outcomes? And lastly is how does information governance influence operational efficiency in organization?
So now we focus on research methodology. For this study, we use a qualitative research method, specifically document analysis, to explore the role of information governance in healthcare. We review a variety of sources, including scholarly journals, policy documents, and government reports and white papers related to the topic. To find this, we search well-known academic databases like PubMed Scopus and Google Scholar. We only selected documents that were published within the last 15 years and that were directly relevant to healthcare information governance. This method was helpful because it allowed us to analyze complex and multidisciplinary issues using a wide range of information. However, there was some limitations such as depending on the quality of existing literature. To reduce bias, we include documents from diverse institutions and regions. Overall, this approach helps us gather meaningful insight while maintaining academic credibility.
Next, historical development of information governance in healthcare. It's all began in early 19 when hospital used paper-based system to record information patient. In 1928, the American College of Surgeons took a big step by working to standardize medical record. This was the start of modern health information management. Moving forward to the 1960 and 1970, electronic health record or EHR began to emerge, especially in places like Denmark and in the US. By the late 1990, privacy became a major concern. The United States introduced HIPAA in 1996 and the UK followed with the Caldecott Principles in 1997. Both focus on protecting patient confidentiality. In 2002, the UK improved its policy across the National Health Service to strengthen information governance. Then in 2014, the American Health Information Management Association released formal IG principles focused on protection, integrity, and transparency of data. Now, other countries also use a similar system, which is they focus on safe, trusted, and easy to access health information. Now, moving on to the key principle of information governance. First is accountability. Accountability means assigning clear responsibility to certain individuals or role in the organization for managing, securing, and ethically using information. This principle ensure that policy are applied consistently and that rules like compliance officer or data steward are in a place to monitor and manage data governance. Without accountability, it's become difficult to prevent or trace measure of information. This could lead to a loss of trust and potential legal issue. So, in short, accountability helps maintain control, build trust, and ensure that the right people are responsible for protecting health information. Next, data quality and integrity. Quality and integrity are crucial because medical decisions depends on accuracy of data. If the information is outdated or incorrect, it can lead to serious issue like wrong diagnosis or mistreatment. That's why IG framework focus on ensuring all data inconsistent, validated, and complete across all systems. As mentioned by Kahtani 2022, using standard data quality protocols can improve patient outcome and reduce risk. Next, information governance framework in healthcare. This framework has been developed by well-known global organizations such as OECD, Huud, or World Bank, and AHIMA. They provide structured approach for managing health data effectively and ethically. For AHIMA, 2018, they suggest that healthcare organizations should establish governance charter, set clear policy, and appoint specific roles like chief data officer and data stewards to ensure proper oversight of data. For PAHO World Bank, 2021, the framework they focus on ensuring that health data is used fairly and equitably. They also emphasize the need to strengthen legal and technical system and align information governance with each country digital health strategies. Next, moving on to challenge in implementing information governance healthcare. First one is interoperability and data silos. Many hospital and clinic use different electronic health record system that cannot communicate with each other. discrete isolated data, or what we call data silos, making it hard to share patient information across department or facilities. This affect care coordination, slow down decision making, and weakness accountability and data accuracy. Next, number two is ensuring staff compliance and engagement. Um, this one, healthcare workers are not fully trained or aware of the importance of IG. Some may resist change in workflow or be unsure of their responsibilities in handling data. Without full staff cooperation, it's hard to maintain consistent standards. Third one is data privacy and security risk. Healthcare data is sensitive, and poor protection can lead to serious breaches. Outdated system may lack strong security features, and it can be hard to keep up with privacy law like PDPA or HIPAA. Protecting data is a hard responsibility in any IG plans. Last one is the role of technology in information governance. New technology in evolving quickly, but many healthcare systems struggle to keep up. Integrating things like automation or AI into IG take times and money. System also need regular update and investment to remain secure and effective. Next, the roles technology in information governance. Technology is the backbone of effective IG in healthcare system. It support organization, protection, and optimization of health data across digital platform. The key technology is include first one is electronic health record, which is EHR. Second, cloud storage system, and last one is data analytic tools. Is ensure data quality, integrity, and regulator compliance. And with this technology, is enabled to secure data sharing among healthcare professionals, protection of patient privacy, and can get better clinical and administrative decision making. Modern IG use AI and automation for access control, audit trails, and database base detections. This information governance help comply with privacy law like HIPAA and GDPR. It's also effective IG combine technology, people, policy, and procedure to build trust in digital healthcare.
Okay, now we're moving on to findings. So basically, we are able to find three of findings that able to answer our question. Now, firstly, I'm going to explain for the first one, which is enhancing data quality, security, and accessibility. So from our research, it is stated that IG can improve accuracy, completeness, and consistency of health data. It also can enable interoperability via standard schemas and metadata. And lastly, it can boost data reliability for better decision and clinical outcomes. And then for the second one, we found that it can improve operational efficiency, which it can support workflow optimization and cost reduction, and also can enable to innovation. And lastly, it can enhance resource use and tech adoption. And lastly, we found that IG in healthcare can help supporting clinical decision making and patient outcomes. It also by structuring, the more structured IG can ensure reliability clinical data and reduce documentation errors. And it also can facilitate data sharing for accurate diagnosis and better care coordination. And lastly, it can lowers professional errors and improve the patient safety and result. So based from this finding, which is we able to found that is basically can answer and help to be answer our question and make the healthcare system environment are more structurable and organized.
We moving on to the next is identify, which is Best practices in information governance. In this slide, we look at some of the best practices in implementing information governance in healthcare. One key practice is using standards frameworks such as ISO, IEC 38505, which helps align data in IT with strategic goals, and DMBOK, which focuses on areas like data quality, metadata management, and security. These frameworks bring several benefits. They help promote consistency among healthcare providers, ensure legal and regulatory compliance, and build trust and accountability with stakeholders. Most importantly, they help healthcare organizations link their data management with broader goals like improving patient care and supporting medical research. Next, gaps and weakness in information governance implementation. While best practices exist, there are still challenges in implementing information governance effectively. One major issue is the lack of integration with daily clinical flows. Information governance must be built into regular routines so it doesn't disrupt clinical decision or slow down operations. Some practical solutions include adding validation check to electronic health records and using simple secure access control to protect patient data. When information governance is well integrated, it helps reduce manual errors, improve staff compliance, and supports real-time tracking through audit trails. Overall, proper integration boosts both patient outcome and the efficiency of the healthcare system. For conclusion, the study highlights the importance of information governance in improving healthcare systems. Information governance plays a key role in making healthcare data more accurate, secure, and accessible, which helps doctors make better decisions, improve patient outcomes, and increase operational efficiency. By using tools like electronic health records and workflow automation, information governance help reduce errors and manage resources more effectively. However, there are still challenges. Many healthcare organizations face outdated systems, a lack of staff training, and growing cybersecurity risk that can limit the success of information governance. To address these issues, it's recommended that organizations adopt proven frameworks like ISO or IEC 38505 and DMBOK included information governance in everyday clinical workflows and invest in ongoing staff development. Taking these steps can help healthcare providers build trust, ensure legal compliance, and succeed in today's digital health environment.
That's all from us. Thank you for listening our presentation.